Meow. Professor Whiskers here with an important health lesson. You learned emergency phrases. Help! I need a doctor. Call an ambulance. That is for serious situations. Today we learn regular doctor visits. When you are sick, but not an emergency. Describing symptoms. Understanding what the doctor says. Getting medicine. I have a headache. My throat hurts. I had a fever for 2 days. The doctor will prescribe medicine. You need to know body parts, symptoms, medical vocabulary, pharmacy conversations. By the end of this lesson, you can go to the doctor, describe what is wrong, and get medicine. Let us learn doctor English. Cats have 9 lives and rarely get sick, but humans need doctors. I understand. First, essential body parts. You need these to describe where it hurts. External body parts. Head. Top of your body, where your brain is. Face. Front of your head. Eye. Eyes. You see with your eyes. 2 eyes. Ear. Ears. You hear with your ears. 2 ears. Nose. You breathe and smell with your nose. Mouth. You eat and speak with your mouth. Tooth. Teeth. Inside your mouth. For chewing. Throat. Inside your neck. Food and air go through throat. Neck. Connects head to body. Shoulder. Shoulders. Where arms connect to body. 2 shoulders. Arm. Arms. 2 arms. Hand. Hands. 2 hands. At end of arms. Finger. Fingers. 5 on each hand. 10 total. Chest. Front of upper body, where lungs and heart are. Stomach. Or belly, where food goes. Middle of body. Back. Behind your body. Opposite of chest and stomach. Leg. Legs. 2 legs. For walking. Knee. Knees. Middle of leg. Bends. Foot. Feet. 2 feet. At end of legs. Toe. Toes. 5 on each foot. 10 total. Practice saying these. My head hurts. My throat is sore. My stomach feels bad. My back hurts. Quick body check. Point to your head. Head. Point to your stomach. Stomach. Point to your throat. Throat. Good. You know basic body parts. Now, let us learn how to describe what is wrong. Symptoms. Common symptoms vocabulary. Pain. Something hurts. Ache is similar. Headache. Stomachache. Backache. Fever. High temperature. Your body is hot. Cough. Coughing. Sound from throat. Cough. Cough. Sore. Painful and sensitive. Sore throat. Sore muscle. Runny nose. Liquid coming from nose. Common with colds. Stuffy nose. Cannot breathe through nose. Blocked. Dizzy. Room feels like it is spinning. Cannot balance well. Nauseous. Feel like you are going to vomit. Sick to stomach. Tired. Fatigue. No energy. Very sleepy. Swollen. Bigger than normal. Puffy. Rash. Red spots on skin. Itchy usually. Describing how bad it is. Slight. A little bit. Not serious. Mild. Not too bad. Bad. Serious. Severe. Very serious. Very bad. Time expressions. Since yesterday. Started yesterday. For 2 days. Continuing for 2 days. This morning. Started this morning. Before seeing doctor, you need an appointment. Calling to make appointment. You. Hello? I would like to make an appointment with a doctor. Receptionist. What is the problem? You. I have a bad cough and fever. Receptionist. Can you come in tomorrow at 2 p.m.? You. Yes, that works. Thank you. Receptionist. What is your name? You give name. Receptionist. See you tomorrow at 2. Walk-in clinic. Some clinics take walk-ins. No appointment needed. You. Do you take walk-in patients? Receptionist. Yes. Please fill out this form and wait. Urgent, but not emergency. You. I need to see a doctor today. I am very sick. Receptionist. We have an opening at 4 p.m. You. I will take it. Thank you. Now you are at the doctor. Complete conversation. Checking in. Receptionist. Hello? Name please? You. Smith. I have an appointment at 2. Receptionist. Yes. Please have a seat. The doctor will call you. You wait. Nurse. Smith. You. Yes. Nurse. Come with me. With the nurse. Nurse takes basic information. Nurse. Let me check your temperature. Open your mouth. You open mouth. Thermometer goes in. Nurse. 39.5 degrees. You have a fever. Nurse. Let me check your blood pressure. Hold out your arm. Nurse puts cuff on arm. Nurse. Blood pressure is normal. The doctor will be with you shortly. Doctor enters. Doctor. Hello. I am Dr. Johnson. What brings you in today? You. I have been feeling sick. I have a fever and a bad cough. Doctor. How long have you had these symptoms? You. For about 3 days. Doctor. Any other symptoms? You. Yes. My throat is sore, and I am very tired. Doctor. Let me examine you. Open your mouth and say, ah. You. Ah. Doctor. Your throat is very red. Let me listen to your lungs. Breathe deeply. You breathe. Doctor. I hear some congestion. Does your chest hurt when you cough? You. Yes, a little. Doctor. Any headache? You. Yes, I have a headache too. Doctor. It sounds like you have the flu. I will prescribe some medicine. Rest. Drink lots of water, and you should feel better in a few days. You. Do I need antibiotics? Doctor. No, this is viral, so antibiotics will not help. The medicine I am prescribing will help with the symptoms. You. Okay, thank you. Doctor. If you do not feel better in 5 days, come back. Doctor gives you a prescription. What happens next? Understanding the prescription. Doctor. Here is your prescription. This is for the fever and pain. This one is for the cough. You. How do I take them? Doctor. Take 1 tablet of this 3 times a day with food. Take this cough syrup twice a day. You. Morning and night? Doctor. Yes. Morning and before bed. You. Can I take them together? Doctor. Yes. That is fine. You might feel drowsy. Do not drive after taking the cough medicine. You. Okay. How long do I take these? Doctor. 5 days. Finish all the medicine even if you feel better. You. Thank you. Important prescription questions. How many times a day? With food or without food? Can I take them together? Are there side effects? How long should I take this? Now you go to pharmacy to get the medicine. At the pharmacy counter. You. Hello. I have a prescription. Pharmacist. Let me see it. Takes prescription. Okay. This will take about 10 minutes. Please wait. You wait. Pharmacist. Smith. You. Yes. Pharmacist. Here are your medicines. This is for fever and pain. Take 1 tablet 3 times a day with food. You. Okay. Pharmacist. This is cough syrup. Take 2 teaspoons twice a day, morning and night. It might make you sleepy. You. I understand. Pharmacist. Do not drink alcohol while taking these. You. Okay. Pharmacist. Any questions? You. No. Thank you. How much? Pharmacist. That is $45. You pay. Pharmacist. Feel better. You. Thank you. Buying over-the-counter medicine. Some medicine does not need prescription. You can just buy it. Excuse me, I need something for a headache. Pharmacist. These are good. Paracetamol or ibuprofen. Which one is better? Pharmacist. Both work well. Ibuprofen is stronger. I will take the ibuprofen. Pharmacist. Take 1 or 2 tablets every 6 hours. Do not take more than 6 in 24 hours. Okay? Thank you. Common over-the-counter medicines. Pain reliever. For pain and fever. Paracetamol, ibuprofen, aspirin, cough medicine. For coughs. Cold medicine. For runny nose, congestion. Anticide. For stomach problems. Allergy medicine. For allergies. Important phrases for understanding and following medical advice. Rest and recovery. Get plenty of rest. Sleep a lot. Drink lots of fluids. Water, juice, tea. Stay in bed. Do not go to work. Avoid cold drinks. Do not drink cold things. Eat light meals. Nothing heavy. Do not exercise. Rest your body. Come back in a week. Return for checkup. Questions about recovery. When can I go back to work? In a few days, when the fever is gone. Can I exercise? No. Rest for at least a week. What should I eat? Light food. Soup is good. Can I drink coffee? Better to avoid caffeine. Drink water. If you do not understand, sorry. Can you explain that again? Can you write that down? How do you spell that medicine name? Can I take a photo of the instructions? Red flags. When to come back. If your fever goes above 39 degrees. If you cannot breathe well. If you cannot breathe well. If you do not improve in 5 days. Come back immediately if these happen. Homework time. Task 1. Point to body parts and name them in English. Practice 10 body parts. Head, eyes, ears, nose, mouth, throat, stomach, back, arms, legs. Say them out loud. Task 2. Write a complete doctor visit conversation. Include making appointment, describing symptoms, getting prescription, and getting medicine at pharmacy. Use today's lesson as guide. Task 3. In the comments, tell us, have you ever been to a doctor in a foreign country? What was it like? Or describe a time you were sick and what symptoms you had. Example, I got the flu in Japan. I went to a clinic. The doctor was very kind. He prescribed medicine, and I felt better in 3 days. Or, last month I had a terrible headache and fever. I stayed in bed for 2 days. Share your medical experience in English. In Lesson 44, we learn at the bank, exchanging money, using ATM, opening account, asking about fees, financial English, managing money, essential for travel and life. But today, you learn doctor English, body parts, symptoms, making appointments, describing what is wrong, understanding prescriptions, getting medicine. Going to the doctor in a foreign language is stressful. Now you know what to say. You can describe your symptoms. You can ask questions. You can understand instructions. Medical vocabulary is important. Keep this lesson saved. Review it when needed. Write down the names of any medicines you take regularly. In English, keep that information with you. If you have allergies, write them down. I'm allergic to penicillin. I'm allergic to nuts. Very important for doctors to know. Being sick is never fun. Being sick in the foreign place is worse. But with the right language, you can get help. Stay healthy, but if you get sick, you are prepared. Feel better. Meow.